Hello guys, once again welcome to our YouTube channel. So today we are discussing about drugs affecting the blood flow. So in this here I am writing about the main difference between arteries and veins, that on which blood vessels antiplatelet drug is going to act and in which vessels antifibrin drug is going to act. So as we all know, in arteries there is more concentration of platelet is more as compared to the fibrin, and in veins concentration of platelet is less as compared to the fibrin. So here in arteries, if platelets are more in quantity, so in arteries the more effective drug is antiplatelet drugs. So here at it I write it. So in arteries antiplatelet drug is more effective, and in veins fibrin quantity is more as compared to the platelet. So in veins antifibrin drug is more effective. Antifibrin drug is more effective in veins. Now next, normally normally in our blood platelet does not stick. So platelets when the platelets will stuck when some factors help in the aggregation of platelets, like glycoprotein 2b and glycoprotein 3a. These help in aggregation of platelets. So in antiplatelet drug we have to inhibit these two factors, glycoprotein 2b and 3a. So need glycoprotein 2b and 3a inhibitors. So our, like in this, b and a is there, so in our drug also ba is there. So ba, so epcizimab, tirofiban, eptifibatide. In epcizimab a or b, and 2b and 3a, so ba. So epcizimab, tirofiban, eptifibatide. So we also have to understand one main question, that this is the strongest antiplatelet drug. So strongest antiplatelet drug is against gp2b and 3a inhibitor. gp2b 3a inhibitor, ba means the drug name also contain ba or ab, like epcizimab, tirofiban, eptifibatide. So this is our first antiplatelet drugs, gp, glycoprotein 2b and 3a inhibitor. So now move on to the next, like if there is injury to the vessels, so when their blood vessels is injured, there should be release of thromboxane A2 and adenosine diphosphate receptor. So adenosine diphosphate and thromboxane A2 will release. So these factors help in the aggregation of platelets. So now we are learning about antiplatelets. So we have to inhibit these factors, thromboxane A2 and adenosine diphosphate. So thromboxane A2 inhibitor and ADP inhibitor. First we are learn about thromboxane A2 inhibitor, like thromboxane A2 inhibitor. Here A is common, so drug name also contain A, like aspirin. Thromboxane A2 inhibitor, aspirin. As we all know, aspirin inhibit cyclooxygenase, COX inhibitor drug. So aspirin is COX inhibitor drug. In a few minutes later I will discuss the path through which we all know that how the COX enzyme help in formation of thromboxane A2. So aspirin inhibit the thromboxane A2 inhibitor. Now our third drug should be against the ADP. So ADP inhibitor, adenosine diphosphate inhibitor drug. So this contain D. It contained D. So in our drug name also there is D, like clopidogrel, ticlopidine and prasugrel. So clopidogrel, ticlopidine. Prasugrel is newly drug which is formed recently. So prasugrel. So there is this is the fastest drug. So prasugrel is the fastest acting drug. But there is one side effect of prasugrel. Side effect, like not side effect, we mostly say that it is contraindicated in stroke. Because why it is contraindicated in stroke? Because it can lead to hemorrhagic stroke. Prasugrel has one side effect, that it can lead to hemorrhagic stroke. It can lead to hemorrhagic stroke. So this is contraindicated. So prasugrel is fastest acting drug and it is contraindicated in stroke because it lead to hemorrhagic stroke. So adenosine diphosphate inhibitor is clopidogrel, ticlopidine, prasugrel. Thromboxane A2 inhibitor, A for aspirin. So aspirin is COX inhibitor. And one more above is GP2B and 3A inhibitor. That is the strongest antiplatelet drug. So So these are apsizumab, tirofiban, aptifebatide. So these are three groups which I already discussed with you. Now I am going to tell you how the aspirin COGS enzyme help in formation of thromboxane A2. Like as we all know, thromboxane A2 is produced from the membrane. So thromboxane A2 in this phospholipid is produced from the membrane, and phospholipid help in the formation of thromboxane A2. So like this is the phospholipid. From phospholipid arachidonic acid is formed, and from arachidonic acid there are two pathways, like which first one is from leukotrienes and one is PGG2. So leukotriene are formed by lipooxygenase enzyme, and PGG2 is formed by cyclooxygenase enzyme. So from PGG2 we will form thromboxane A2, prostacyclin, and PGD2, E2 and F2. So we have to inhibit the formation of thromboxane. So how we can inhibit it? By inhibiting COGS enzyme. So if we inhibit this COGS enzyme, so thromboxane A2 will not form. So for our first drug is COGS inhibitor, like thromboxane A2 inhibitor. So aspirin. So aspirin is irreversible COGS inhibitor. So this is the pathway. And one more thing we have to learn, like thromboxane A2 is formed by platelets and prostacyclin is formed by endothelium. So thromboxane A2, here I want to tell you that I for inhibitor means this is inhibition of platelet aggregation. It help in inhibition of platelet aggregation, means prostacyclin inhibit platelet aggregation, and thromboxane A2 in this A will come. It means that it help in aggregation. So so that's why we are going to inhibit thromboxane A2 now, because we don't need to aggregate our platelets. So we are using antiplatelet. Antiplatelet means these act on thromboxane A2 and inhibit thromboxane A2 so that platelet does not aggregate. So aspirin, as we discuss all the factors, like aspirin is inhibit cyclooxygenase drug, cyclooxygenase enzyme, and it is irreversible. And one more thing, like platelet does not have nucleus. So platelet does not have nucleus, so it means that after giving aspirin, thromboxane A2 level in blood will decrease and prostacyclin level also decrease. But prostacyclin is formed by endothelium, and endothelium have nucleus, as we all know. So endothelium have nucleus, but platelets does not have nucleus. So it means that thromboxane A2 will decrease, and after some time prostacyclin level again increase due to regeneration of prostacyclin. So here I am writing, platelets don't have nucleus, thromboxane A2 decrease in blood, and endothelium have nucleus. So after few hours prostacyclin increase in blood. Now next, ADP receptors act on platelet by P2Y2. So we have to inhibit P2Y2, Y12, P2Y12. We have to inhibit so that platelet does not stick. So the drugs are P2Y12 inhibitor drugs are clopidogrel and ticlopidine, as we already discussed above. So clopidogrel and ticlopidine, these are irreversible drugs. So if we are giving a patient clopidogrel or ticlopidine, so before surgery we have to stop these drugs before 1 week, because these are irreversible drugs. So that's why we stop these drugs before 1 week and need to wait for 1 week before surgery. Now there are prodrug also, like CYP2C19 drug. So these are CYP2C19 and omeprazole inhibit the clopidogrel. So if we give omeprazole and clopidogrel, so these drugs will not affect each other because they negligize both their actions. So prasugrel, next drug is prasugrel, irreversible inhibitor of ADP receptor. This is also irreversible inhibitor, and this is faster acting, as I discussed above. So prasugrel is faster acting drug, antiplatelet drug, and the risk is hemorrhagic stroke, so contraindicated in stroke, as I already discussed above. So these are all irreversible drug. Now I am going to tell you reversible drug which act on P2Y12 inhibitor. So in this like cangrelor, ticagrelor. In this also grill come. So OR, R means reversible, R means reversible, reversible. So cangrelor, ticagrelor. So basically I learned this drug by trick, canteen like canteen. So can for cangrelor, T for ticagrelor, and R for reversible. So our next last antiplatelet drug is about PAR1 inhibitor. So how this, like thrombin activates platelets, and complement factor of thrombin is 2A. So this thrombin on platelets have thrombin receptor, and the name of the receptor is PAR1. So protease activator receptor 1. So we have to inhibit this receptor also. So the PAR1 antagonist drug are, in which PAR is come, means PAR, PAR, P, A and R. So A for antagonist, so means X, here X means antagonist, and A comes on number 1 in ABCD, so 1. PAR, PAR 1 inhibitor. So in this the ending should be Paxil. So atopaxil, vorapaxil. Like there is one song na, wo raate, तो वैसे vora और ato means vora paxil, ato paxil. So these are 4 drugs, these are antiplatelet drugs in which I study about the ADP inhibitor, GP2P and 3A inhibitor, and thromboxane A2 inhibitor, and PAR1 antagonist drug. I hope you all like this video. Thank you so much. Bye.